Hi, I'm here with two of my coworkers, and I'm going to teach them about how to take and deliver proper care to the Amish people. Hi, girls. I just want to teach you some of the cultural considerations when you have an Amish patient. First of all, it's important to remember that the Amish people believe in folk medicines and faith healings and herbal treatments, so you need to take that into consideration when you're planning for their care. They also believe that their good health is a gift from God, and so they need to take proper care of it. They do believe in modern medicine, but they believe that it can only help them, that only God can heal them. So that's important also. When you're taking care of an Amish patient, they prefer to be called by their first name. They're insulted if you use Mr. or Mrs. Also, patients will only be seen by experienced doctors and nurses. They do not like to be handled by interns or students, so those should only be used as observers. Patients also prefer that their healthcare provider will sit with them and answer questions one-on-one. They don't like to just be left and wondering who's going to answer their questions. So that's important that you take the time to spend a little extra time with them. The Amish people are only educated to the 8th grade level, so you have to use 8th grade language with them. If you speak medical terminology with them, they will not understand you, so they won't be able to properly understand how to take care of themselves or even what's wrong with them. Also, they learn best by demonstration, picture stories, and role modeling when you're trying to educate them on how to take care of themselves when they go home. It's also important that you cover all possible treatments and interventions with them, even though they may refuse them because they don't have the electricity, the money, or the proper understanding of their disease. It's important to take into consideration special circumstances with the Amish. One of them is that they pay very little attention to preventative care. It's hard to impress upon them the importance of immunizations, cancer screenings, pap smears, and other preventative type things. It's mostly because they believe that God heals them, but it's also because they can't afford it and they don't have very good access to it because of mostly transportation issues. Also, things to consider are that Amish don't believe in birth control, so they have very large families, which result in pregnancy issues because they have very late in life pregnancies and because just so many pregnancies and the toll it takes on the body. Also, to take into consideration, they prefer to die at home rather than the hospital. So if you have a patient who is terminal, it's important to try to get them home before they die. And when prescribing medicines, it's important to keep in mind if they have to keep refrigerated, they may not have the means to keep them cold. Other things to consider is that you may need to bend visitor limitations if necessary, if your hospital has limits on visitors. Or you may need to have a place for their family to gather, because it's not uncommon to have very large groups present at the hospital since they depend on others for transportation outside their community. Also, it's so uncommon to have people in the hospital with Amish that they just tend to bring large groups. Also, when planning for their care, try to use home health whenever possible. It's less expensive, it can be delivered in their own environment, and it avoids transportation issues for them. Other issues, because they marry within their own community, genetic disorders are highly prevalent in their community. So those are something to look out for and educate them on. The Amish do not like the use of life flight helicopters, so try to use ground transportation whenever possible. The Amish are likely to refuse autopsies. And also, money is not usually spent on keeping the elderly alive. So they will usually choose to let them die. They also don't feel that's just God's plan for life. The Amish religion doesn't forbid its people to seek medical care. When it's necessary, they can have surgery, dental work, anesthesia, and blood transfusion. They also can have organ transplants, but you should know they can't have heart transplants because Amish people believe that once they're baptized, then the heart is the soul of their body, so they will not have heart transplants. And that's all. Do you guys have any questions? No, ma'am. Okay, thanks for listening.
Thank you.